that the households are unstable. I can't write a prescription for that. No, you can't. But you're the canary in the coal mine, and communicating to other agencies to help us connect people to the resources that they need. So that's the type of collaboration. It's not necessarily always asking or demanding for new spending, but it's actually using the resources that we already have in place in a much smarter way. And of course, there will be gaps and there will be a need to move resources, but at least going about it in this systematic fashion, we have created a system and a blueprint and highlighted specifically where systems are failing individuals instead of these blanket statements about systems failures or broken systems in themselves. So that's what our partners are doing across the country in addressing gun violence prevention and addressing access to behavioral health care in schools, integration of services to provide parent coaching inside of pediatric primary care facilities, bringing food stores and creating food stores within schools in areas that are food insecure. Those are the types of collaborative solutions that we have. Now, those are at the service level, but we've also, through this process, created legislative changes, investments in trauma-informed care, investments in school-based mental health issues, creation of community collaboration with community police. And why was that important? Not just around police brutality, but the reduction of community stressors. Because oftentimes, and we know this, communities, lower income communities, whether they are white or they're Black, are policed very differently than higher income communities. And that policing practice differences creates higher levels of stress in those communities. Those higher levels of stress are directly attributable to higher levels of heart disease, diabetes, obesity, because that's what stress does to the body. It gets under the skin. So yes, there's a public health concern with regard to community policing because it affects people's health. And that's the story before the gun. And so that's why it's so important for us to think about when we talk about violence prevention, when we talk about improving community outcomes, why each one of us in this room, regardless of our sectors, have a contribution to make to community resilience. So if we go to the next slide, this was one of the first graphics that I actually created to communicate in a very simple fashion these complex ideas around the synergy or the interactivity between systems and individuals. So I used the science of adverse childhood experiences that have the 10 classic ACEs: maternal depression, emotional and sexual abuse, substance abuse, domestic violence, homelessness, incarceration, mental illness, divorce, physical and emotional neglect. The science shows us that early exposure to these elements in childhood are tied to the onset, and particularly the early onset, of the leading chronic diseases in our country. This is a powerful, powerful body of science that really urgently calls us to act early, and yet we were sitting on it for almost 10 years. And that's what led to the whole BCR process, because I was like, how can we not act upon what we already know? At the same time that we're spending billions of dollars on obesity, tackling obesity, well, hello. Obesity is actually a symptom of an adverse childhood experience. In fact, in the original ACEs interviews, they came out of the obesity clinic at Kaiser Permanente, where you had women talking about they were victims of early sexual abuse and they were eating to hide themselves, to make themselves no longer attractive to the person who was abusing them. So obesity isn't just about what we love to have put so much money in the last 15 years, healthy eating and physical activity. It's so much more. And we know that because we've barely moved the needle on doing just that, creating better habits, teaching people how to eat their broccoli. How many people ate their broccoli today? Good. Eat your broccoli. But it's about so much more than that, because what's in the soil? Look at what's in the soil that coexists with many of these negative outcomes. We're looking at poverty, concentrated poverty. We're looking at discrimination, poor housing quality and affordability, community violence. These things interact. So you can't zoom in on just the branches and the leaves if you're not actually changing the soil and creating a richer soil that creates different outcomes for people. So this is how, moving to the next slide, we frame the issue with regard to understanding adversity, but then we want to put that in context. So these next couple of slides put the parabases specifically in context for Washington, D.C. And this is how, remember I said earlier, it's not just the data, it's also the stories. And it's using pictures, it's using images, because we all are visual creatures. But it's important for us to be able to speak on multiple different levels and multiple different channels to be able to get the message through and to help people understand what is your role in actually contributing to a solution here. So in Washington, D.C., we first used this heat map to understand the connection between environment and particularly race and place. So using the parabasis framing, we first said, okay, well, where are our children living? And we did a heat map here so you can begin to understand the racial mix in the city. And so you have an east-west gradient. The further east you go, the higher concentration of children of color. Let's go to the next slide. And then when you think about the root causes of youth violence, which has been a headline here in the city, really for the last 2 years, we have to think about what not only are the violent incidents, but also what are the structural violence? What are the elements of structural violence that these individuals are living within? And so these are data from the latest Kids Count survey that was done for 2022. And it helps us to understand, again, with that east-west gradient in mind, these are the statistics for our children who are most caught up in youth violence. 52% of Black adults in households, 52% of Black adults in households with children experienced more than half of an income loss during the pandemic, 52%. 23% of white adults in households with children experience the same economic burden. When we look at youth unemployment, between April and September of 2020, almost 29 times as many people under the age of 22 received unemployment insurance as during the same period in 2019. An explosion in the people who are supposed to be in the most productive years of their employment opportunities. An explosion of individuals seeking unemployment insurance. Over 1/3 of DC renters with children said they have no or only slight confidence in their ability to make next month's rent. Let that sit for a minute. When we think about that parabasis framing, what is happening in that household? When we talk about loss of learning, we know that external stressors impact the brain development for our young children in a negative fashion. It literally impairs their ability to learn, to sit still, to focus. That's what's happening. So when we think about these external stressors, the community stressors, and we hold that with the same environment, the headlines that we see of our children picking up guns, of robbing Uber Eats drivers and doing all kinds of violence. Violence begets violence. This is structural violence that is happening to our communities. And we're showing our children how much or how little we have invested in them and their future. What do children do when they're angry? What do children do when they want attention? They act out. And they're acting out in very lethal ways. So it's not about fixing kids, not solely about fixing kids. We have to fix and invest in our environments. So the next slide really is meant to drive this home with regard to policing, which Kenny and I have worked on together, to really understand the disproportionality of contact for Black youth in DC. The disproportionality of contact, 7 out of 8 children stopped by police. 7 out of 8 children stopped by police across the district. I'm not just talking about east of the Anacostia. I'm talking about across the district, are Black. I watched it happen in Chinatown at a coffee table, at a coffee shop. I watched 3 Black kids minding their own business, suddenly having police officers question why they were there, question their presence for being. That happens. What does that do to a young child at a young age? What does that communicate to them? They didn't ask, hey, what are you doing? Let's trade some baseball cards. Hey, I see you got on that really cute that neat jersey. You for that team? No, it was shaking them down. What are you doing here? What are you up to? The presumption of guilt. And that's what happens to our children every day. 7 out of 8. The statistics don't lie. My eyes didn't lie. But that's also a form of structural violence. Again, violence begets violence. So let's go to the next slide. It brings us all back home with regard to race and place, why it's so important for us, particularly here in the district, to address this. So again, keeping in mind that east-west gradient, one of the things I like to do, and not just here in Washington, D.C., but across the country, is to help people to understand how the disproportionate or inequitable application of policy by race and by place contributes to many of the outcomes that we see, or commingle with many of the outcomes that we see. So this is looking at it through the criminal justice lens and connecting it to social outcomes as well as to public health outcomes. So as you see again at that top piece here, this is looking at population by race. So again, that east-west gradient. Looking at poverty rate below the federal poverty level. So you see the higher concentration here, east of the Anacostia to west. Then let's compare that to Department of Corrections intakes by ward. And you almost have a 1-to-1 ratio here. The higher the concentration of poverty, the higher the intake rate. Remember what I said about communities of color, in particular lower income communities, being policed very differently? If you have a higher chance or probability of interacting with a police officer in your community, then you have a higher probability of being arrested for whatever reason. Then if we go up a little bit here, you can see the burden of inequity, that this isn't just about criminal outcomes and poverty outcomes, but these things are connected in real time to real social and health outcomes. Again, the unemployment rate, that same east-west gradient. Diabetes, because remember, this all gets under the skin. Diabetes, heart disease. Now, the only time that this flips is when we talk about life expectancy. But of course, we're killing people slowly by the policies in our practices. So of course you have a higher life expectancy west of the Anacostia in comparison to east of the Anacostia. You have a lower level of stress. You have a higher opportunity for social and economic mobility. Of course you're going to live longer. That's simple science. So let's move up to the next slide. And how we look at these data and how we tell these stories, how we interpret, really does serve as a means for us to examine our policies from a historical fashion. Because what happened in those graphs above are not something that just happened over 10 years. This is the accumulation of policy over, quite frankly, centuries. How many people in this room have read Chocolate City? It's an excellent historical analysis of how DC was formed. And so it helps us to understand, again, just despite the fact that we've always had a higher concentration of African Americans, Black, whatever the decade is and whatever they decide to call us or we call ourselves, there has always been policies that have restricted movement, have restricted the ability for employment, have restricted the ability to practice democracy, to practice self-rule. All of these things are driven, and we have to face the fact that many of these policies were all driven with a race dominance in mind, and that race was white. Now, does that make anyone in this room guilty? No. But it makes us all complicit if we don't face our history, and if we don't work towards changing it. So one of the things that we always talk about, we go back to, is looking at racial wealth gap. And how did we get to where we are today? Well, you know, we've only recently in our history had the ability, when I say we, people of color, have only recently in this country's history had the ability to attend almost any college that we could apply to and be entered into, accepted into. And I say that because it was shortly after World War II where that became something that the doors began to open. They were busted open after desegregation, but there are still other tactics that are being used to keep people of color from ever being able to enter in some of the halls of higher education. How we invest in public education is one of the most important things. Because if you can't be educated and ready for college, it doesn't matter if you theoretically could be admitted if you're not prepared. And we have to all admit the way that we invest in public education is leaving most of our children behind. That's by design, because that goes back to housing, actually. And housing is the critical piece here that contributes to both the educational gap as well as the racial wealth gap in this country. We have policies and practices. I say present tense, because many of you know about the practices of appraisal that have come under property appraisal that have come under scrutiny in the last couple of years, that a Black family putting their home up for sale oftentimes has their home devalued compared to the same home in the same neighborhood, or the same house, actually, if they just change out the pictures. And any reference that looks like it's a Black family's home will sometimes knock $50,000, $100,000 off the value from that appraiser. That's real. That's happening in real time. Of course, then that's building off of our policies of redlining that today has critically shaped not just Washington, D.C., but every city in our country. Every city, when we look at predictably those neighborhoods with the highest concentration of poverty, the highest concentration of under-resourced schools and public health outcomes, it's all traced back to redlining. And that contributes to the racial wealth gap in this country, because how we pass on wealth in this country is largely rooted in home ownership. That's the largest way, the most popular way of passing on generational wealth. And so if you've closed the pathway for swaths of individuals to ever actually attain home ownership, then you've critically cut off a pathway to building intergenerational wealth. And it wasn't just home ownership, it was also life insurance. And many of our insurers who would refuse to provide whole life policies to Black individuals. That's another way in which wealth is passed on. So critically examining how we got to where we are today is so important, because if we don't do that in the context of history, we're not really solving the problem. We're putting a Band-Aid on what we can see today. Let's go to the next slide. The last part that I want to talk about really, though, is what you all are involved in clearly, and that's civic participation. So part of the work that we do is not just highlighting the historical policies, yes, that's important, and creating these policy agendas for change, but it's also getting people to be involved in the process. And one of the things that I highlight in Washington, D.C. that I find very interesting, but I see this as where we have the greatest potential for systems change, is looking at where we have civic participation by ward. Combined, Ward 7 and 8 have the highest block of civic participation in this city. That tells me that what you have is a great opportunity to capitalize both on social cohesion and social capital. That means we listen and we provide the tools for activation for systems change. Not that we in this room are going to come up with all of the solutions, but that we work directly with community members to co-design those solutions and listen and make those investments accordingly. This is what Kenny and I have been involved in, and this is currently what we're involved in with my center, in creating a community design solution around gun violence prevention. And it's about everything before the gun. And the most important part of it is the activation of our youth. So we're doing a whole youth advocacy boot camp. We're teaching them, what's the city budgeting process? What are committee hearings about? What is the process of passing legislation? When you go visit a legislator, how do you use your best 15 minutes of time? How do you make an ask? Prepare testimony and testify in council hearings. Being an active member of the civic process is how we begin to make change. It's not just protests. And I tell the kids, it's like, you know, the protest signs, that's, yes, get your anger out, what have you, but that's checkers, folks. We got to play chess. And playing chess means that you're in the system, you're working with partners across sectors, and you're making change. So I'd love to tell you more about specifically how we're doing that, but my time is done.
I could listen to you for another couple of hours, Dr. Ellis, happily.
I want to thank you, but ultimately, you know, this is really about, if we just go to the last slide there, it is about equity. And equity isn't about what one group loses to benefit another. It's about making sure that people have exactly the supports and the resources that they need to move forward and to thrive. So thank you.
Thank you, Dr. Ellis. We do have some time for some Q&A. Kenny, you've got first out the gate.
Hey, Wendy, my first question to you, and I just want to make a couple of statements real quick. I tried hard to get my PhD. I got my master's because when I say something, people want to question me. But when you say it, as Dr. Ellis said, it's got to be right, right? And the second thing is I want to let my Rotary Club members know that I'm not just some nut going around screaming gun violence. It's a lot of work, like working with you and trying to work and coordinate things that Rotary Club you all don't even know anything about, and that I do. And so I'm glad Wendy's here, because it's not just about screaming gun violence. But Wendy, what I want you to address, when we got together, we did a program with George Washington and you, the Rotary Club, and Noble. And that work, which was fantastic, we did, that was approved. It was approved by the research department of GW. And Rotary Club is the one that funded it. It was about a focus groups with police and community. Could you address that for a moment?
Yes. So what Kenny is speaking to is we collaborated with his organization, and it was funded by the Rotary Club and Noble, which is the National Organization of Black Law Enforcement officers. And so it was an opportunity to really understand, and this really came out of some of the work that I was doing in Ward 7 and 8 out of Unity Healthcare. So what the essential issue was that the providers, the primary care providers at Unity Healthcare, wanted to do this, you know, program where they were going to begin to address the social determinants of health. And they kind of did what we expect physicians to do. They said, well, you know, let's do some nutrition classes. Let's create a maternal depression support group. And I said, you know, yeah, that's great because that's what your patient data indicate. But have we asked patients what is it that they feel like they need to achieve optimal health and well-being? And so they said, oh, well, sure, we can set you up, Dr. Ellis, in our office, and maybe you can do a few interviews. And I said, yeah, let's do that. I interviewed 63 patients as they were coming in for their regular visits. And I had one simple question. What is the greatest barrier for you in achieving what you would say is optimal health and well-being? The number one issue that was stated was their interactions with Metropolitan Police. And well, and number two was every woman that we interviewed, and I want to preface this was the summer before Me Too. Every woman that I interviewed talked about her own history of being a victim of sexual violence. It was so normalized, though, that I had a woman who was in the room with her 8-year-old grandson, and she's talking about this very explicitly. And I said, "What? You know what? Why don't we find something else for the baby to do?" And and this happened on more than one occasion where the woman is beginning to relay and to retell her experience in the presence of a child. And what that told me was that trauma has become so normalized that people don't even understand that they've been traumatized. They can't recognize their own trauma. This has become part of the norm. So when Kenny and I got together, it said, obviously we have police presence, not just the activity, but police presence that is creating an environmental stressor for individuals. That has to be addressed. And is there a way to bring the two together, to bridge this difference? And so our work was interviewing police officers to understand their interactions, their perceptions in community, and working with Black youth, but also separate series of interviews with Black youth to understand what are your perceptions of police, what would be, some solutions for you, what would you like to see? And so that research is actually informing the work that we're now doing with the district. We've been funded by the district to do this community-sourced solution towards gun violence, and much of the evidence that we produced is pointing towards not just training for police officers, but other roles in community that unfortunately police officers are being called to take on that are well outside of their training and well outside of their scope, but are much needed in community. But also what supports and resources are needed to provide more positive outcomes and supports for our youth. So it's not necessarily blaming police officers. I think, there are some bad apples for certain, but oftentimes we have to ask people, are you really doing the job that you thought you were going to do? Did you understand what it meant to walk the streets of neighborhoods every day? Most of us would have to admit that's probably not what they thought they were getting into. And neither do our youth see. I think our youth are the ones that are confirming that. Like, these are not the people that should be in our neighborhood in this way.
Thank you so much, Dr. Ellis. I'd like to, I understand you have to run, but I'd like to let you know that we're going to plant a tree in your honor as our speaker, and your tree will be identifiable and searchable on the Trees for the Capital program. So, thank you.